Hello, let us now study the Norma Lateralis. What is Norma Lateralis? It is the studying or viewing of the skull from the lateral side is Norma Lateralis. So, what bones can be seen in Norma Lateralis? And the bones which can be seen are the frontal bone, the parietal bone, the occipital bone, the nasal bone here, then the zygomatic bone, the temporal bone, the sphenoid bone and the maxilla. So, these are the 8 bones which can be seen in the Norma Lateralis. Coming to the features, it consists of temporal lines. So, there are 2 temporal lines which begins from the frontal process of the zygomatic bone like this. This is a superior temporal line which extends from the frontal process of the zygomatic bone, runs upwards, backwards and is lost in the parietal bone. Similarly, we have from the same site where the superior temporal line arises, a faint inferior temporal line can also be seen which arches along with the superior temporal line, and posteriorly it is continuous with the supramastoid spine here. So, one is superior temporal line, the other one is inferior temporal line. So, to the superior temporal line, the temporal fascia is attached, and to the inferior temporal line, the temporalis muscle is attached. And the region here, this ovoid shaped region what we are seeing here below the inferior temporal line, we call it as temporal fossa, to which temporalis muscle takes origin. An important feature in this is this one. This is called as Tyon. It is called as the Tyon, which is the meeting point of 4 bones in a form of H-shaped suture here. We can see the 4 bones are frontal bone, parietal bone, the squamous part of temporal bone, sphenoid bone. The meeting point of these 4 bones in the form of H-shaped suture is called as Tyon. This is important clinically because this region of the bone is comparatively thin, and on the inner side of it you can see the branches of middle meningeal artery and the tributaries of middle meningeal vein lying. Hence, when there is a fracture over here, it can tear that blood vessels and could result in oozing of the blood, resulting in extradural hematoma. The importance of Tyon is formation of extradural hematoma. Then we have this bone which is the zygomatic bone, which consists of upper border, lower border, outer surface and inner surface. The structures related superficially to this from anterior to posterior are superficial temporal vein, superficial temporal artery and auriculotemporal nerve. Vein in front, artery in the middle and nerve behind. To the lower border of this zygomatic arch is the attachment of the masseter. That means the origin of the masseter lies over here. It not only takes origin from the lower border, it also takes origin from the lower half of its inner surface. Then we have features like this one is external acoustic meatus. External, this is the margin to the margins of the external acoustic meatus. We can see the cartilages of the ear are attached, and posterior to it, this region we call it as Massivens triangle or suprameatal triangle. This region just lying behind and slightly above to the external acoustic meatus, we call it as Massivens triangle or suprameatal triangle. From this region around half centimeter inside will be the mastoid antrum. Then on this zygomatic arch, this one you are seeing, this is the tubercle of root of zygoma, to which a ligament of the temporomandibular joint, that is the lateral ligament of the temporomandibular joint, is attached to this zygoma. Then We have more posteriorly here, this one is the mastoid process, which is an downward extension of mastoid part of the temporal bone, and this mastoid process, from anterior to posterior, the muscles attached are sternocleidomastoid in front, splenius capitis in the middle, and longissimus capitis behind. If you see here, although it is broken, here you can see a hook-like projection downwards, which should be called as the styloid process. This styloid process gives attachments to 3 muscles and 2 ligaments. This process, together with those structures, are called as styloid apparatus, and the 3 muscles are stylohyoid muscle, styloglossus muscle, and stylopharyngeus muscle, and the 2 ligaments are stylomandibular ligament and stylohyoid ligament. Another important feature in the Norma lateralis is this one, which is the infratemporal fossa, which has certain boundaries and certain contents, and this topic of infratemporal fossa I will be saying it in the next class. Thank you.